Cardiac Pharmacology NCLEX style practice questions and detailed rationales. Question 1. Myrtle is 79 years old. She has heart failure with preserved ejection fraction and takes furosemide 40 mg daily. She presents with hearing loss and ringing in her ears or tinnitus that started suddenly. She has no ear pain or discharge. What is the most likely cause of Myrtle's symptoms? Option A. Myrtle has age-related hearing loss. Option B. Myrtle has Meniere disease. Option C. Furosemide-caused ototoxicity. Option D. Myrtle has an ear infection. The correct answer is option C. Furosemide-caused ototoxicity. Loop diuretics like furosemide cause ototoxicity, including hearing loss and tinnitus. The risk increases with high doses, rapid administration, and kidney disease. Myrtle's symptoms may be reversible if the drug is stopped or the dose reduced. She needs an audiogram and a switch to a different diuretic like a thiazide or metolazone if possible. The nurse who dismisses this as age-related misses a preventable drug side effect. Myrtle's hearing may recover if the furosemide is stopped soon enough. Question 2. Tyrone is 56 years old. He has coronary artery disease and takes clopidogrel or Plavix 75 mg daily. He is scheduled for a colonoscopy with polypectomy. The gastroenterologist wants to stop clopidogrel for 7 days before the procedure. Tyrone had a drug-eluting stent placed 4 months ago. What is the best action? Option A. Stop clopidogrel as ordered. Option B. Continue clopidogrel because stopping causes high risk of stent thrombosis. Option C. Stop clopidogrel but bridge with enoxaparin. Option D. Switch clopidogrel to aspirin alone. The correct answer is option B. Continue clopidogrel because stopping causes high risk of stent thrombosis. Tyrone is within 6 to 12 months of his drug-eluting stent. Stopping clopidogrel carries a 30 to 50% risk of stent thrombosis, which has a 40% death rate. The colonoscopy with polypectomy can be delayed until Tyrone completes 12 months of dual antiplatelet therapy. The gastroenterologist is unaware of the stent. The nurse must advocate for Tyrone. His heart is more important than his colon. The colonoscopy can wait. His stent cannot. Question 3. Vernon is 68 years old. He has heart failure with reduced ejection fraction and takes Entresto or sacubitril valsartan 49 to 51 mg twice daily. He presents with severe dizziness and lightheadedness. His blood pressure is 85/50. His heart rate is 70. His potassium is 4.2. His creatinine is 1.1. What is the most likely cause of Vernon's hypotension? Option A. Entresto causes symptomatic hypotension in up to 15% of patients. Option B. Vernon is dehydrated. Option C. Vernon has adrenal insufficiency. Option D. Vernon has a gastrointestinal bleed. The correct answer is option A. Entresto causes symptomatic hypotension in up to 15% of patients. Entresto contains sacubitril and valsartan. The valsartan component causes vasodilation and hypotension. Symptomatic hypotension occurs in up to 15% of patients, especially in the first few weeks. Vernon needs his dose reduced or his other antihypertensives adjusted. He does not need a workup for adrenal insufficiency or bleeding. The nurse who knows this side effect prevents unnecessary testing. Vernon's blood pressure will improve with dose adjustment. Question 4. Yvette is 63 years old. She has hypertension and takes amlodipine 10 mg daily. She also takes atorvastatin 80 mg daily. She presents with severe muscle pain and weakness. Her CK is 8,500. Her creatinine is 2.8. What caused Yvette's rhabdomyolysis? Option A. Amlodipine alone caused rhabdomyolysis. Option B. Atorvastatin alone caused rhabdomyolysis. Option C. Amlodipine increased atorvastatin levels by inhibiting CYP3A4. Option D. Yvette has a viral infection. The correct answer is option C. Amlodipine increased atorvastatin levels by inhibiting CYP3A4. Amlodipine is a weak CYP3A4 inhibitor. Atorvastatin is metabolized by CYP3A4. The interaction causes atorvastatin levels to rise by 1.5 to 2 times. Yvette is also on the maximum dose of atorvastatin. The combination caused rhabdomyolysis. She needs 4 fluids and both medications stopped. She should be switched to pravastatin or rosuvastatin, which are not metabolized by CYP3A4. The nurse who blames only the statin misses the interaction. Question 5. Marlon is 55 years old. He has no medical problems. He presents for a routine physical. His blood pressure is 145/92. His BMI is 32. He drinks 4 beers daily. He eats a high-sodium diet. What is the most appropriate first step? Option A. Start lisinopril 10 mg daily. Option B. Start hydrochlorothiazide 12.5 mg daily. Option C. Recommend lifestyle modifications for 3 to 6 months. Option D. Start amlodipine 5 mg daily. The correct answer is option C. Recommend lifestyle modifications for 3 to 6 months. Marlon has stage 1 hypertension with no target organ damage. The guidelines recommend lifestyle modifications for 3 to 6 months before starting medication. Weight loss, reduced alcohol, reduced sodium, and increased exercise can lower blood pressure significantly. Marlon may avoid lifelong medication if he makes changes now. The nurse who starts medication without lifestyle counseling misses an opportunity. Marlon deserves a chance to change his habits first. Question 6. Nadine is 72 years old. She has atrial fibrillation and takes apazaban or Eliquis 5 mg twice daily. She falls at home and hits her head. She has a 3 cm scalp laceration. She is alert and oriented. Her neurological exam is normal. The emergency physician wants to discharge her after suturing her scalp. What should the nurse do? Option A. Discharge Nadine as ordered. Option B. Insist on a head CT before discharge. Option C. Give Nadine a head injury instruction sheet and send her home. Option D. Call Nadine's family to pick her up. The correct answer is option B. Insist on a head CT before discharge. Nadine is on a direct oral anticoagulant. She hit her head. Intracranial bleeding can occur without early symptoms. A head CT is mandatory regardless of her normal exam. The physician is wrong. The nurse must advocate for the CT scan. Nadine's life depends on it. The CT may show a subdural hematoma that requires reversal and neurosurgery. No CT means sending Nadine home with a potentially fatal brain bleed. Question 7. Oscar is 48 years old. He has hypertension and takes clonidine 0.2 mg twice daily. He misses 2 doses while on a fishing trip. He presents to the emergency room with a blood pressure of 210/115, severe headache, nausea, and sweating. What is the priority treatment? Option A. Restart clonidine immediately. Option B. Give 4 labetalol. Option C. Give 4 nicardipine and restart clonidine. Option D. Give oral nifedipine. The correct answer is option C. Give 4 nicardipine and restart clonidine. Oscar has clonidine withdrawal hypertensive crisis. The priority is to lower his blood pressure with a short-acting 4 antihypertensive like nicardipine. Then restart his clonidine. Giving only 4 labetalol without restarting clonidine will not address the withdrawal. Giving oral nifedipine is dangerous and no longer recommended. The nurse who understands clonidine withdrawal saves Oscar from a stroke. His blood pressure will stabilize once clonidine is back on board. Question 8. Priscilla is 67 years old. She has heart failure with preserved ejection fraction and takes furosemide 40 mg daily. She presents with severe hearing loss and tinnitus that started yesterday. She has no ear pain. She recently had her furosemide dose doubled. What is the most likely cause? Option A. Priscilla has age-related hearing loss. Option B. Furosemide caused ototoxicity. Option C. Priscilla has Meniere's disease. Option D. Priscilla has an ear infection. The correct answer is option B. Furosemide caused ototoxicity. Loop diuretics like furosemide cause ototoxicity, including hearing loss and tinnitus. The risk is dose-dependent and more common with rapid 4 administration but can occur with oral doses. Priscilla's hearing loss may be reversible if the furosemide is stopped or reduced. She needs an audiogram and a switch to a different diuretic if possible. The nurse who dismisses this as age-related misses a preventable drug side effect. Priscilla's hearing may recover if the medication is stopped soon. Question 9. Quincy is 59 years old. He has coronary artery disease and takes clopidogrel or Plavix 75 mg daily. He is scheduled for a dental extraction. The dentist wants to stop clopidogrel for 5 days before the procedure. Quincy had a drug-eluting stent placed 3 months ago. What is the best action? Option A. Stop clopidogrel as ordered. Option B. Continue clopidogrel because stopping causes high risk of stent thrombosis. Option C. Stop clopidogrel but bridge with enoxaparin. Option D. Switch clopidogrel to aspirin alone. The correct answer is option B. Continue clopidogrel because stopping causes high risk of stent thrombosis. Quincy is within 6 to 12 months of his drug-eluting stent. Stopping clopidogrel carries a 30 to 50% risk of stent thrombosis, which has a 40% death rate. The dental extraction can be done with local hemostatic measures while continuing clopidogrel. The dentist is unaware of the stent. The nurse must advocate for Quincy. His heart is more important than his tooth. The extraction can proceed with clopidogrel on board. Question 10. Rosalind is 54 years old. She has hypertension and takes lisinopril 10 mg daily. She presents with a persistent dry cough for 2 months. She has tried over-the-counter cough suppressants with no relief. Her chest X-ray is normal. What is the best action? Option A. Continue lisinopril and add a steroid inhaler. Option B. Stop lisinopril and switch to losartan. Option C. Stop lisinopril and switch to amlodipine. Option D. Stop lisinopril and switch to hydrochlorothiazide. The correct answer is option B. Stop lisinopril and switch to losartan. Lisinopril-induced cough is caused by bradykinin accumulation. The cough resolves within days to weeks after stopping the ACE inhibitor. Losartan is an ARB that provides similar cardiovascular benefits without causing cough. Switching to losartan is the best option because it preserves RAS blockade. Amlodipine and hydrochlorothiazide work but are different classes. The nurse who treats the cough instead of the cause keeps Rosalind suffering. Her cough is not a mystery. It is the medication. Question 11. Sherman is 71 years old. He has atrial fibrillation and takes warfarin. His INR is 2.5. He starts taking amiodarone for atrial fibrillation. 1 week later, his INR is 5.2. He has no bleeding. What caused Sherman's INR to rise? Option A. Amiodarone increased warfarin absorption. Option B. Amiodarone inhibited warfarin metabolism. Option C. Amiodarone killed gut bacteria that produce vitamin K. Option D. Amiodarone caused liver damage. The correct answer is option B. Amiodarone inhibited warfarin metabolism. Amiodarone inhibits the metabolism of warfarin by competing for CYP2C9 and CYP1A2 enzymes. The interaction causes the INR to rise within days to weeks. Sherman's warfarin dose must be reduced by 30 to 50% when starting amiodarone. The nurse who fails to anticipate this interaction causes a potentially dangerous supertherapeutic INR. Sherman needs close monitoring and a dose reduction. His INR will be checked frequently until stable. Question 12. Tanya is 39 years old. She is 26 weeks pregnant. She has chronic hypertension and takes labetalol 200 mg twice daily. She presents with a blood pressure of 170/110 and proteinuria. She is diagnosed with preeclampsia with severe features. The provider orders for magnesium sulfate. Tanya asks why she needs magnesium. What is the best response? Option A. Magnesium lowers your blood pressure. Option B. Magnesium prevents seizures in preeclampsia. Option C. Magnesium helps your baby's brain development. Option D. Magnesium relaxes your uterus to prevent preterm labor. The correct answer is option B. Magnesium prevents seizures in preeclampsia. Magnesium sulfate is the standard of care for seizure prophylaxis in preeclampsia with severe features. It reduces the risk of eclampsia by 50%. Tanya's blood pressure is also dangerous, but magnesium is for seizure prevention, not blood pressure. The nurse explains that Tanya needs both magnesium for seizure prevention and 4 antihypertensives for blood pressure control. Tanya and her baby are at risk without both interventions. Question 13. Ulysses is 65 years old. He has heart failure with reduced ejection fraction and takes carvedilol 25 mg twice daily. He presents with dizziness and lightheadedness when standing. His lying blood pressure is 115/70. His standing blood pressure is 85/50. His heart rate is 60. What is the most likely cause? Option A. Carvedilol caused orthostatic hypotension. Option B. Ulysses is dehydrated. Option C. Ulysses has autonomic dysfunction. Option D. Ulysses has adrenal insufficiency. The correct answer is option A. Carvedilol caused orthostatic hypotension. Carvedilol is a non-selective beta blocker with alpha-blocking activity. The alpha blockade causes vasodilation and orthostatic hypotension. This is a known side effect, especially in older adults. Ulysses may need a lower dose or a switch to metoprolol, which has no alpha-blocking effects. The nurse who checks lying and standing blood pressure identifies the problem. Ulysses does not need 4 fluids. He needs a medication adjustment. Question 14. Vera is 52 years old. She has no medical problems. She presents with palpitations. Her EKG shows supraventricular tachycardia at 210 beats per minute. She is hemodynamically stable. The provider orders adenosine 6 mg for push. What is the correct administration technique? Option A. Push adenosine slowly over 1 minute. Option B. Push adenosine rapidly over 1 to 2 seconds followed immediately by a 20 ml saline flush. Option C. Push adenosine mixed with 10 ml of saline over 30 seconds. Option D. Push adenosine and then wait 30 seconds before flushing. The correct answer is option B. Push adenosine rapidly over 1 to 2 seconds followed immediately by a 20 ml saline flush. Adenosine has a half-life of less than 10 seconds. It must be given as a rapid 4 push over 1 to 2 seconds followed immediately by a rapid saline flush to push the drug into the central circulation. Slow administration allows the drug to be metabolized before it reaches the heart. Vera's SVT will not convert. The rapid push and flush are not optional. They are essential for success. The nurse who administers adenosine correctly converts Vera's rhythm. Question 15. Wilma is 77 years old. She has atrial fibrillation and takes dabigatran or Pradaxa 150 mg twice daily. She presents with acute onset of severe back pain and bilateral leg weakness. She cannot move her legs. An MRI shows spinal epidural hematoma. She had a lumbar epidural steroid injection for back pain 2 days ago. What was the likely cause? Option A. Dabigatran caused spontaneous spinal bleeding. Option B. The epidural injection caused trauma that bled due to dabigatran. Option C. Wilma has a spinal tumor. Option D. Wilma has a spinal cord infarct. The correct answer is option B. The epidural injection caused trauma that bled due to dabigatran. Dabigatran and other direct oral anticoagulants increase bleeding risk with neuraxial procedures like epidural injections. The recommended hold time before an epidural is at least 48 hours for dabigatran and 5 days for warfarin. Wilma's injection was given without stopping her anticoagulation. She now has permanent paralysis. The nurse who fails to ask about anticoagulation before an epidural causes catastrophic harm. Wilma will never walk again. Question 16. Xavier is 43 years old. He has no medical problems. He presents with a blood pressure of 155/98 on 3 visits. His BMI is 35. He drinks 6 beers daily. He smokes 1 pack daily. What is the most appropriate first step? Option A. Start lisinopril 10 mg daily. Option B. Start hydrochlorothiazide 25 mg daily. Option C. Recommend lifestyle modifications including weight loss, alcohol reduction, smoking cessation and dietary changes. Option D. Start amlodipine 5 mg daily. The correct answer is option C. Recommend lifestyle modifications including weight loss, alcohol reduction, smoking cessation and dietary changes. Xavier has stage 1 hypertension with no target organ damage. The guidelines recommend lifestyle modifications for 3 to 6 months before starting medication. His heavy alcohol use and smoking are major contributors. He may avoid lifelong medication if he makes changes now. The nurse who starts medication without lifestyle counseling misses an opportunity. Xavier needs support to change his habits. His blood pressure will improve with reduced alcohol alone. Question 17. Yolanda is 66 years old. She has heart failure with preserved ejection fraction and takes furosemide 80 mg daily. She presents with severe weakness and muscle cramps. Her potassium is 2.8. Her magnesium is 1.3. What caused Yolanda's severe electrolyte depletion? Option A. Furosemide caused potassium and magnesium wasting. Option B. Yolanda has gastrointestinal losses from diarrhea. Option C. Yolanda has renal tubular acidosis. Option D. Yolanda has hyperaldosteronism. The correct answer is option A. Furosemide caused potassium and magnesium wasting. Loop diuretics like furosemide cause significant potassium and magnesium wasting. Yolanda's potassium of 2.8 and magnesium of 1.3 are dangerously low. She is at risk for Torsades de Pointes and cardiac arrest. She needs 4 potassium and 4 magnesium. Her furosemide dose may need to be reduced, or she may need a potassium-sparing diuretic added like spironolactone. The nurse who fails to monitor electrolytes in a patient on high-dose furosemide causes harm. Yolanda's weakness is a warning sign of impending cardiac arrhythmia. Question 18. Aaron is 58 years old. He has hypertension and takes lisinopril 20 mg daily. He also takes spironolactone 25 mg daily for acne. He presents with weakness and palpitations. His potassium is 6.7. His EKG shows peak T waves. What is the priority intervention? Option A, stop lisinopril only. Option B, stop spironolactone only. Option C, stop both medications and give 4-calcium gluconate. Option D, give 4 insulin and dextrose without stopping medications. The correct answer is option C, stop both medications and give 4-calcium gluconate. Aaron has severe hyperkalemia from 2 potassium-raising medications. Lisinopril and spironolactone together are dangerous. For calcium gluconate stabilizes the heart immediately. Both medications must be stopped permanently. Aaron did not tell his primary care provider about the spironolactone from his dermatologist. The nurse who fails to ask about all medications misses the interaction. Aaron's heart is at risk of arrest. He needs emergency treatment now.